tell me a little bit about this fresh fund that's come in?
I'm happy to tell you about this. We are incredibly excited. The Social Innovation Fund is an initiative of the Obama administration. There are a number of different social innovation funds throughout the federal government. The one that we applied for was through the Corporation for National and Community Service. And folks may be familiar with AmeriCorps or some of the other Serve America programs, and it's through that same federal agency that these funds were made available. They were made available in 3 areas. We actually applied under Healthy Futures, and we're one of 11 grantees. The grant is about to be announced today in Washington. I'm thrilled to be here in Vienna to be able to share really good news about the United States and about how, in this case, the Obama administration is making non-HIV specific money, new money, available that will support at the Access to Care pillar of the National HIV/AIDS Strategy, which was just released last week. So the National AIDS Fund is humbled and also very proud to be part of this new Social Innovation Fund initiative. We will be making grants available through an open and competitive RFP process. That RFP has not been developed. It will be coming in the next couple of months, and it'll be posted on our website. We'll send it out to the AIDS community broadly. I think one of the things that I really want to say, though, about this is not business as usual. This is game-changing money. It's $3.6 million a year of federal money that we have to match with private sector resources. So I think the first message is to challenge and invite the private sector, corporations, foundations, and individual philanthropists to really step up and join the administration. A lot of folks have been asking how they can help to really ensure that the strategy is implemented. Having a national HIV/AIDS strategy is great, but implementation is going to be an entirely different story. And it's going to require investments from both the public and the private sector. So we're really excited about the challenge. And certainly in this economic environment, it will not be easy, but we're up for the challenge. We will raise at least $3.6 million from the private sector. And then when we make the sub-grants, those grantees at the local level collectively will also raise $3.6 million. So we're talking about a significant new investment of resources into HIV and AIDS, and in this case, specifically around access to care. We know that there are about 600,000 people in the United States, which may be really hard for people to believe, that in the United States there are 600,000 people living with HIV that are not connected to care. And for some of them, it's because they don't know that they're HIV positive because they haven't been tested. And for others, it's because they experience barriers to accessing care that may range from stigma to lack of transportation to living in a rural community where there simply aren't physicians available or physicians aren't trained in how to treat HIV infection. For us, this is about creating a game-changing opportunity for community organizations to come together. In order for this to truly change systems, to really change how people deal with the challenges and barriers, to remove those barriers, to ensure they have access to quality care, it cannot just be the same organizations running solo. This is an opportunity for the AIDS community to work with mental health, to work with substance abuse providers, to work with clinicians, to work with treatment educators and activists, to really create comprehensive systems change efforts in their communities, to work with homeless shelters and youth programs. And so we're going to be challenging communities to really think about preparing collaborative applications, coming together as a group in a true collaboration, building on each other's strengths, and finding ways to fill the gap so all people living with HIV in the United States have access to quality care. The National AIDS Fund has largely focused on prevention over the years, and the reason that we focused on prevention was because that was the place that there was the fewest amount of resources from both the public and the private sectors. You know, while we are thrilled to have the Ryan White Care Act, I mean, that certainly hasn't met all the needs, but it's been a really significant investment. So up to this point, we've focused on prevention. We recently launched our Access to Care work. It's a collaboration that we've talked about before, Positive Charge with Bristol Myers Squibb and the Walmart Foundation. But this takes that to a whole nother level and really moves beyond, just a few funders and takes the leadership that those private sector funding partners brought to the table and hopefully challenges and has challenged the public sector and the private sector to make different investments. So yes, we will be doing work that we have not historically done to this scale. Certainly we have supported care and treatment work at the community level because the National AIDS Fund's model is that we want to invest in the needs that communities tell us they have. We don't sit in Washington and decide what the priorities are in New York City or in Oakland, California, or in Tulsa, Oklahoma. So with these resources, though, we also want to target them. We want to target them to the communities that are most impacted by HIV and who have the most unmet care need. So if there are communities that are highly impacted but have really good systems in place to get people connected to care, then those are probably not the places that we will invest in the most. But if there are places where there's good care happening, but there are system tweaks or ways that they could enhance their systems to make them more efficient, to make them work better for people living with HIV, then of course we'll make investments there. We want to spur innovation with this money. We want this to be game-changing opportunities for people living with HIV and for the organizations that serve them.
You've been doing this work for some time. Does this feel like a different time? Does this feel like we have new energy, new commitment from the federal leadership? Can we really make a difference?
We can absolutely make a difference. I mean, I'm the eternal optimist. I don't think you can be in this work as long as I have been and not continue to at least be hopeful. But I would certainly say that I am more hopeful today than I have been in a really long time. And that's not just because of this grant. This grant is a significant contributor. The Social Innovation Fund, the idea that the federal government has recognized that using Social Innovation Fund money to spur innovation, to challenge the HIV/AIDS community, and to provide this opportunity to the HIV/AIDS community and to the public health community as a whole to really think about how we can build on the accomplishments we've made, but also take them to another level. In this administration, I think many of us in the AIDS community are very, very pleased that the Obama administration committed to having a national HIV/AIDS strategy and has worked with the community to deliver one. Now I think we also can't stop with the Social Innovation Fund. We have to hold the administration accountable and Congress accountable and public officials at the state and local level accountable to ensuring that there are sufficient resources for everyone who's at risk to be tested and everyone who tests positive to have access to primary medical care and to specialty HIV care that's of the highest quality. We can't settle for less than that, and we cannot settle for less than having the private sector step up to be partners in that process. And that, for me, today gives me a tremendous amount of hope in Vienna. And I can't wait to get back to the States to celebrate and to really be able to work with communities. Because I think this is going to seed some new hope in communities that haven't seen new resources in a really, really long time. To focus on women, to focus on gay men, to focus on communities of color, to focus on disenfranchised youth. And that's what this is about. That's where this innovation can really change lives.